Okay, we've been sent a case for evaluation, and looks like this patient is going to be losing tooth number 4 in the upper right-hand side. And I'd like to go ahead and go through our plan. So the first thing that, one of the first things I'll always evaluate on these cases is this what kind of guide would this be? And in this particular case, I would think it's safe to say that this will be an OptiGuide. As we can see here, we have plenty of natural teeth. And then to have an OptiGuide, we need at least one tooth posterior and ideally all the way over to the cross arch. So here we can see that we do have just enough CEREC data to allow us to fabricate a well-fitting OptiGuide. One comment on this one would be next time go ahead and capture it right here. So that way you can go ahead and capture to the premolar, maybe even the bit of the molar, so that you can use a bite block to hold the data in place. So next, let's go ahead and take a look at our implant plan. What I like to do when planning these is to duplicate the existing plan, and that way we can compare and contrast this plan to the plan that we have here. So in looking at this plan, my initial assessment is that there's quite a bit of work that needs to be done. If we take a look at this buccolingually, we're pretty well centered. Mesiodistally, we're pretty well centered. But now when we start looking at bone level presents a bigger issue for us. So I'd like to continue move along here. So in looking at this, one of the things that I see of concern is a bone level position. So here we can see our bone level goes to right here and a bone level goes to right here. We know that we're going to lose some, so our implant really needs to be placed almost right there from a bone level perspective. Now, in looking at our next thing, we can also see that this implant as it is coming out of the lingual wall of this tooth. So we know that we want the implant to be coming out of the central groove there. So then we need to go ahead and rotate the implant just like so. And now we can see that we're coming closer out of the central groove of the tooth. Now our next issue that we have to look at in this particular case is also vital structures. We have our sinus. So right here we know that we can not go much longer because we're riding up against the sinus unless we want to do a sinus bump. And not that there's anything wrong with doing a sinus bump here, but the sinus bump isn't going to give us any of the stability that we need. So in also looking at this, we can also see that right now we're still quite a bit to the distal and looking right here. So this implant needs to be moved, tilted or moved over. We're going to tilt this. We're going to tilt this because we cannot move it over because we'll get too close to the adjacent root. In fact, we're probably going to move it over just a hair like this to gain our space and then tilt it back to get it more centered here, as you can see in this view right here. So now the next question is going to be stability. Are we going to gain stability? In this view, we can see that stability is going to be difficult. For stability, we want 3 millimeters of apical extension at a minimum. And here we're not going to achieve that 3 millimeters. So if we go to a longer implant, certainly that is an option. And here still not going to get 3 millimeters. And now we're running very close to the sinus. Again, not that big of a deal here as doesn't seem to be puncturing through. So my suggestion in this particular case, one other thing to take a look at is the bone level discrepancy between the mesial of the tooth and the distal of the tooth right here. There looks to be some significant bone loss on this particular tooth. So as we do a 360 view, we can see this vertical bone loss a little more clear right here. So Given all these factors, my suggestion on this particular case would be to take the tooth out, graft the site, and then come back at the 4 to 5 month mark and reevaluate the possibilities. There's too many things going on here for my comfort level. So my suggestion in this particular case would be to simply extract the tooth, do some grafting, see if we can get a more stable bone position here, get a more stable bone position here on the distal. And we have to also take a look at what's going on with tooth number 3, what our long-term plans are there, and how that affects our overall game plan. Thank you for submitting this case. I look forward to more in the future.